Welcome to the health news channel of the Aya Clinic, where we bring you important news from the world of health and explain it in a manner that can make a difference in the choices of your life.
GLP-1 drugs such as Trulicity, Ozempic, Wegovy, Mounjaro, and Zepbound are a popular class of weight loss and diabetes drugs. Researchers who work at Geisinger Medical Center in Danville, PA, have published a study in gastrointestinal endoscopy that GLP-1 drugs can hinder the safety of a common gastroenterology procedure. The researchers collected data on 35,183 EGD procedures conducted among diabetic and non-diabetic patients. Among 756 diabetic patients who underwent esophagogastroduodenoscopy, also known as upper endoscopy or EGD, between 2019 and 2023, those who took GLP-1 drugs were 1. 4 times more likely to have retained gastric contents during the procedure. 2. About 3 times more likely to experience aborted procedures. 3. Twice as likely to require a repeat EGD. Among 166 GLP-1 users who did not have a diabetes diagnosis and underwent the procedure, they were 1. About 5 times more likely to have retained gastric contents. 2. 5 times more likely to have aborted procedures. 3. As likely as non-users to need another EGD, GLP-1 drugs affect gastric emptying regardless of a patient's diabetes status, the researchers found. No significant differences were found in post-procedure adverse events between GLP-1 users and non-users, and no deaths in either cohort. The researchers concluded that clinicians who are responsible for scheduling and performing EGD for these patients should carefully assess the potential impact of these medications on the procedure's safe completion. Failure to take into account the concomitant use of GLP-1 drugs appears to greatly increase cost and inconvenience of the procedure due to a higher incidence of failed and aborted procedures and the necessity to repeat the procedure. If you are taking a GLP-1 drug such as Trulicity, Ozempic, Wegovy, Mounjaro, or Zepbound, and are planning to undergo a gastroenterologic endoscopy such as EGD or upper endoscopy, then please be sure to inform your GI specialist about this fact and specifically ask them if they would advise you to stop taking these drugs prior to reporting in for the procedure, and if so, how early should you stop the medication? You should also be sure to consult with your primary physician, diabetologist, or weight loss management doctor as to how you should manage your diabetes, metabolic balance, or weight loss during the period when you will have stopped your GLP-1 medication. The Aya Clinic has a metabolic and weight management program called Body for Life that uses a combination of GLP-1 drugs and education and behavior modification under physician supervision. Contact us at 703-404-5900 or by email at myhealth@ayaclinic.com to discuss how you can achieve your goals through our programs. This is a bulletin of your health news you can use from the Aya Clinic. Hit like and subscribe to stay notified in the future, and share this with your friends and family so they can use this news too.